Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hi, I'm Arshdeep. I'm working as a consultant neurologist in Guru Ramdas Medical College, Amritsar, and in Srimati Parvati Devi Hospital.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So the thing is, brain actually is a network of small special cells called neurons.
Yeah.
So the neurons they are interconnected with each other and they transmit signals via electrical signals. So we can say that our brain is kind of a network of multiple electrical wires transmitting signals.
Yeah.
And when a seizure, whatever information is there in brain, is transmitted as electrical signals. So whenever there is a seizure, what actually occurs is there is these signals they are released in an haphazard manner throughout the brain. Not just of one part of brain will be working releasing signals and passing on information. All the brain neurons they start firing at the same time, so
Yeah.
that causes unnecessary involuntary movements and abnormal this tongue biting and all which occurs in uh, actually in seizure.
What is epilepsy?
Epilepsy is a disorder in which a person has a risk of having two or more than two seizures in future, and the underlying cause of these seizures is mostly uh, unknown, or it is not caused due to some metabolic disorders like electrolyte imbalance or infections like fever or decreased glucose. So these are the causes of epilepsy when a patient is at a risk of having more than one seizures, and the underlying cause is mostly uh, not some direct cause. There is no direct cause for that.
What are the different types of seizures and do they affect people differently?
Yes, definitely. So, broad two categories of seizures are there broadly. One is focal seizure. Focal seizure, a particular part of brain is involved, and seizures start from there. So, as a result, only one part of body will start convulsing or
Yeah.
having involuntary movements. Sometimes these focal seizures they may get transmitted to whole brain, and then the person starts with one limb convulsing, and then the whole body starts convulsing. Or sometimes they are generalized.
Yeah.
Generalized to start with the whole of the body, it starts convulsing. So those are broadly two type of seizures, and mostly generalized seizures they are associated with loss of consciousness, and focal seizures or partial seizures many times they are not associated with loss of consciousness.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Many times there is no known cause of epilepsy, but in many cases, some epilepsy has some underlying cause, like head trauma.
Yeah.
In case of head trauma, there is some scarring of brain from which seizures can start. Then brain infections, which can cause some brain damage, and they can ultimately lead to seizures. Then there are certain genetic causes of seizures in which there is a family history, there is a defective gene that causes seizures or epilepsy, repetitive
Yeah.
seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So whenever a seizure starts, in many cases there is a premonition for the patient. If he feels an abnormal sensation which is called aura. So
Yeah.
in aura can be of multiple times, like multiple types, like some epigastric sensation rising in our body, rising upward, or sometimes fear,
Mhm.
deja vu like sensation.
Yeah.
And sometimes patients have auditory hallucinations, they hear things, or sometimes they have visual hallucinations, or they start seeing abnormal things like animals or people talking like that. And
Mhm.
ultimately, after that, the patient starts having seizures. In seizures there is involuntary movement of the body, to and fro movement of the limbs, and sometimes patient feel like that the body is moving. It is actually called tonic-clonic movements, followed by there may be uprolling of the eyeballs, tongue biting, any
Yeah.
injury when the patient falls due to seizure. There may be injury to head or any other part of the body. Then there is frothing from mouth,
Mhm.
and sometimes there is uh, involuntary micturition, involuntary urination, or bowel movement, involuntary bowel movements within the clothes only. And
Mhm.
after some time of mostly 2 to 3 minutes of this activity, the patient he loses consciousness,
Yeah.
and it takes about 5 or 10 minutes, and sometimes half an hour or so, for the
Mhm.
patient to return to his full senses.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
So, in olden times, in many people didn't know about the entirety epilepsy, what causes it. So, when you see somebody having seizures, it is quite a scary thing, actually,
Yeah.
to see someone having seizures.
Mhm.
So at that time, when people were not that aware about this thing and science hadn't made these kind of advances what we see right now,
Yeah.
people used to think it is due to somebody being possessed by a spirit or a ghost. So, or it was due to some sins in his previous life, or sins due to his ancestors, that this thing is happening to him. So it was
Mhm.
associated with some kind of stigma.
Yeah.
As a result, uh, these patients, they were socially outcasted, and nobody wanted to be in their vicinity, nobody wanted them to play with their children, they had difficulty in getting jobs and all. So this
Mhm.
was the stigma associated with epilepsy. Nowadays, we as a
Yeah.
neurologist, as well as many other doctors and community workers, they are trying to educate people about epilepsy, so
Mhm.
that this kind of stigma can be removed associated with this disease.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So, in epilepsy, one must understand that it is very important to take medicine on regular basis.
Mhm.
In any case, it shouldn't be missed.
Yeah.
Many epilepsy cases, about 85% of them, will be treated and patient will be seizure free if
Mhm.
he takes regular medicine. And mostly a single drug is enough. And rarely we have to give 2 or 3 different drugs to patients, but in many cases, a single drug is enough. Along
Yeah.
with that, there are some triggers of epilepsy. Even if we
Mhm.
are taking medicine, if we are not following certain precautions, we the patient may have seizures, like if he misses meals, if he
Mhm.
is not sleeping properly. An 8 hour of proper sleep is very important to prevent a person going into seizures. Then
Yeah.
regular medicines, avoiding stress is very
Mhm.
important. Then
Yeah.
certain infections, like sometimes even fever, high fever can trigger seizures, especially in children.
Mhm.
So all these things should be avoided. If a kid is having fever, try to bring it down with paracetamol or cold sponging. So certain things like these, and we can avoid seizures.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Like if a person is alone at home, so certain precautions can be taken, like carpeting the floors so that if he falls down, head injury can be avoided.
Yeah.
And if he's working in a kitchen, if a person is working in a kitchen, instead of using stoves, you can use
Mm-hmm.
microwave if you are alone. Uh,
Yeah.
and then about dishes, instead of using porcelain or breakable things, you can
Mm-hmm.
use steel or unbreakable dishes.
Yeah.
The utensils that can be taken.
Mm-hmm.
And mostly this, and then about driving. Until you are seizure free, you know that you are seizure free, uh, avoid driving. Try to have somebody with you. Avoid if your seizures are not fully controlled. Avoid going to swimming pool or near fireplaces like this.
Yeah.
An accident can be avoided like that.
Got it.
Otherwise, take your medicines regularly. That's what I would say. Very important factor.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Some of these, what I have told, the lifestyle changes, these can prevent a patient having seizures.
Yeah.
And then, if a person is having seizures, or even if under medicine he is having one or two seizures in 2 months or 3 months, it's good to have some nowadays nasal sprays of anti-epileptics are available. Certain anti-epileptics that should be kept in case of emergencies.
Mm-hmm.
While driving, wear helmets, and I think these would be good enough. Mhm.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
At the end, I would like to say epilepsy is a treatable condition.
Yeah.
Just take it like hypertension or diabetes. As long as you are taking medicine, it will be controlled. There should be no stigma attached to it. And
Mm-hmm.
a person who is having epilepsy is as good as a normal person. He can do everything what a normal person can do. He can do any kind of job, either mental or physical. And just keep taking your medicine regularly if you have this problem, and you'll be fine.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.